I serve with the Guidelines Committee, which is one of East's hardest working and most active committees. I presently serve as the chair of the committee, and I'm actually going on, let's see, 8 years on the committee. This will be my 8th year. So it's been an amazing learning experience being a part of the work that East does to develop practice management guidelines. And I think what's really impactful about what we do is that these are the evidence-based, rigorous, transparent, scientific recommendations that we develop and publish to help trauma surgeons, and not just trauma surgeons. I'm talking critical care, emergency general surgery, injury prevention, and trauma. These are the guidelines that are used all over the world to help guide the care of critically ill, injured patients with emergency and trauma conditions. And it's really an honor to be able to do that. And with respect to the mission of East, East is an organization that seriously and dutifully serves its mission, which is to provide leadership and development opportunities for early and mid-career surgeons. And that's me. I really feel like I've been someone who has benefited so much from being a part of this organization, and at the same time, by serving the organization, by giving my time, I feel like I receive so much more in return from the opportunity to be part of something bigger than myself, to have the opportunity to collaborate with colleagues from all over the US, really from all over the world. And it's truly a remarkable thing to be part of something so much bigger than me and my own practice and my own decisions that I make on a daily basis to care for patients. Really looking to the evidence and using that evidence to develop practice management guidelines impacts so many more patients than I can physically lay my own hands on a day-to-day basis. And that's really, for me, why I do it. It's that ability to have a contribution, to make an impact that's more meaningful than taking care of one patient one at a time, but really having the opportunity to impact the care of multitudes of patients. I definitely recommend that anyone who's not a member of East become a member, first of all, and then second of all, take the opportunity to volunteer when it comes out on a yearly basis. I was actually just speaking to someone who said, how do I get involved? It's very easy. You volunteer, and then you show up and you do a good job, and you basically will find that those opportunities continue to come your way. And it really is the way to help build a career too. And I think that's what East does better than any other organization out there. It really allows early mid-career surgeons to develop their career, find opportunities to lead, and to better serve both our patients, our community, our colleagues, and all of those who are active in the care of injured and ill surgical patients.